just about 2 months ago, so I'm fairly new. I also have a podcast, as Jen mentioned, which I can, give you guys all this information as I go through. Basically, today is supposed to be just a very informal presentation. This is a slide set, but it's like literally just pictures. So I'll go through kind of what happened to me and what I took away from it and what I do now and how I incorporate organ donation and transplantation into my everyday life. So basically, let's see. My story starts out about 4.5, 5 years ago. November of 2018, I started having kind of, let's say, a weird cough, non-specific symptoms. At that time, I had been an ER resident. As a resident, I had finished medical school back in 2016, but during residency is when you're kind of doing your specialty training. I had already been a doctor, but I was finishing up that initial residency in emergency medicine to become an ER doctor. I knew that I really wanted to do critical care. As a ER doctor, you are in charge of the emergency room. As a critical care doctor, you are in charge of the ICUs. I just loved ICU and resuscitation. I was applying to critical care fellowship. So as many of you may or may not know, college, medical school, residency, fellowship usually takes about 15 years. So this was towards the end of my, 15 years. It was when I was 30. Had not gone to ICU fellowship yet, but was interviewing and in that process. And just had never really had any medical issues. I maybe had been to a doctor a few times in my life, but other than that, I never knew what it was like to be sick. Basically, I ended up getting matriculated to a critical care fellowship program, December of 2018. I was celebrating. That's the second picture that you could see. And suddenly one day, my cough got worse while I was actually working, and eventually ended up back in the emergency room. So not as a doctor, but this time as a patient, where I found out I got very, very sick. Basically, my heart essentially stopped. I don't remember much of what happened, but I needed resuscitation. I had to get intubated. I was taken to the ICU. My own colleagues were taking care of me. And I was diagnosed with heart failure and dilated cardiomyopathy, ejection fraction, which is kind of how well your heart beats, was down to 5%. And normally it's, normal is usually above 60. And this was on medications, on support. My EF had been 5%. I was so sick. I eventually got transferred to University of Pennsylvania. We found out, people used to ask me like what exactly had happened, what was the cause. Later on, years down the line, we found out that it was a genetic mutation that had caused all this. But at that time, we didn't really know. We just thought it was this freak thing that had happened to me. When I got to University of Pennsylvania, if any of you guys know anything about the allocation system, it kind of is based on how sick you are. So generally speaking, this is probably the easiest way to put it, but it doesn't encompass exactly how you get listed. The sicker you are, you get to the top of the list. And this was University of Pennsylvania, January 2019. I was diagnosed and listed and transplanted all within a matter of 3 weeks of my life. So it was insane. I got discharged about a week later, and that was kind of what happened. Let me see. I had to go from being, a doctor to a patient in record time. I had to learn how to, be compliant and take medications around the clock. I had a few issues here and there. As many of you know, I did have a rejection episode early on, so they had to, put a line in me at home. And, I kind of was taking it all in at once. When people ask me how I did it, I don't even know if I fully was aware of everything that was going on. The decision to transplant was so sudden. So I feel like I started processing the fact that I was a transplant patient like weeks later. And after I was home, I was like, okay, well, I guess this is my new life. I didn't totally know what to do. Like, I remember I was like, okay, when can I go back to work? I think I ended up taking about 6 months off. And as you know, it was obviously I was hyper immunosuppressed. It was hard for me to be around patients. but I didn't even think of that. I was like, no, I got to get back to work. So, this was before COVID, just about 6 months before COVID hit was when I started seeing patients again. And so I was just wearing an N95 all the time. I did my best. I finished my fellowship. I ended up, actually going to the critical care program that I had gotten into a year earlier. I remember I had emailed them while I was hospitalized at Penn saying like, yeah, I'm in like cardiogenic shock and probably need a transplant, but I really, really want to still do this fellowship if you guys are okay with it. They were okay with it. I ended up going to that fellowship and completing it. And so with that, I remember kind of my journey started. And I think one of the best things that helped me at that time was being able to grieve that old life of mine. So anything that had happened prior to December of 2018 was not going to be my life anymore. But I didn't let that stop me from doing anything. I knew I had these new hurdles and new restrictions that I had to use, but I wasn't going to let any of that stop me. I started volunteering. I did some stuff for Philly AHA, American Heart Association. During residency, I did talks like this. I tried to get a lot of people more aware about my situation, what it was like being a young person with sudden heart failure, how I got through it. These are the things that happened to me and how I feel like we can improve patient care. And so, yeah, I kind of did a little bit of everything with my time. I took those initial few months off, went back to residency, then did my 2-year fellowship. I finished fellowship just last year. So 2022 was when I finished. And it was actually kind of the most ironic accomplishment of all, because this is me with my fellowship kind of certificate, after however many years it took for me to get there. And this is in the CTICU taking care of transplant patients. So it was really, really awesome. Finally, after I graduated, I had done my fellowship at Mount Sinai, New York City. I had happened to be close with my donor's family. The way that we got in touch was after my surgery, I got a letter from them through the OPO, which was Gift of Life, and Finger Lakes. We kind of, over the course of 2 years, had to correspond through letters. If any of you know what the process is like, it's very careful on what you can disclose and what you can't disclose. But eventually, if both parties are okay with it, you can meet in person. So we decided to meet. This was like August, September of 2022, so a year ago. I found out that my own donor was a 23-year-old girl named Lucy. She had a sudden brain cyst rupture, which her mother is very, very open about. Ironically, she was actually studying to become a respiratory therapist. So she had always also wanted to work in an ICU. So here I was, an ICU doctor and the heart of a potential respiratory therapist. It was great. And I'm very close with her family. I consider her parents my own second set of parents. And they love how involved I am with increasing awareness about organ donation and transplantation. This is a picture of Lucy. At that time, she had been studying for her exams in respiratory therapy school. And so, yeah, I owe my whole life to her at this point. And I do as much as I can to educate others about what organ donation is. And obviously, in my new role, I am the medical director over at Donor Network West, an OPO. So I'm learning now about, the importance of how to include donor families and specific things, what organ donation is like, clinical donor management of our organ donors who are in ICUs, patients who and the potential patients that these organ donors could help out. We take care of all that through UNOS and other OPOs across the nation.
So what hospital do you work in?
So how about we leave the questions till the end, okay, Cynthia?
All right.
Okay. So the other things that I was able to do, I tried to embrace as much of what had happened to me. I started volunteering for a committee at AST. AST, if any of you guys know which one that is the front-facing professional society for transplant doctors and nurses. Mostly abdominal, but of course cardiac is in there too. So I am on the TCAC, Transplant Community Advocacy Council. And I actually just became chair this week. So I've been on the committee for 3 years, became chair just this week. And this is us volunteering at the Transplant Games last year. Early on during my transplant journey, I don't know why or how I did this, but started a blog called A Change of Heart. The only reason why I decided to actually start it was because I was getting so many texts every day about what was going on with me, what we could have done. And it was so hard for me to keep up with all the texts and phone calls that I kind of like put everything on this website, like what was going on with me. And eventually it got really, really big. And, people visited all the time. I added in some transplant resources, some things about charity and other organizations that we work with or that I've worked with in the past. Sometimes I do fundraisers through the website. So this was a way for me to not only express myself through writing, but it was a way for me to connect with other recipients too. And I started that back in 2019, and it's still slowly updating, but I was way more active on it earlier. I also ended up doing a really awesome article with some big names in emergency medicine where we did a primer for managing cardiac transplant patients in the emergency department setting. As an ER doctor, we rarely learn about how to take care of transplant patients. So I took this opportunity to kind of teach other people in my own field about how important it was to manage cardiac transplant patients a specific way, the things that we should know. So yeah, that was it was awesome working with these guys on this project. And if you guys have any questions, this is my contact information. I will also give Jen the podcast that we do with both sides of the stethoscope. But it is a podcast that I do with another heart transplant recipient who happens to be a cardiologist. So he is actually going to become a transplant cardiologist. I'm an ICU doctor, and we chat a lot with other recipients. We chat with other professionals, including other doctors, and it's a really fun, podcast that we do a couple times a month when we can. So.
Thank you so much. Guys, if you have any questions, I think now is a great time to ask. And again, I can't reiterate enough. Definitely check out the podcast. It's fabulous. Like I said, for someone who's not really into podcasts, I can vouch for it. It's absolutely fascinating, fantastic. Big proponent of this podcast.
Yeah, it's a lot of fun. It is a very amateur podcast, and we
don't sell yourself short. It's fantastic. It's really, really great. Like I said, for someone who's not a podcast fan, it's excellent. It's really good. And I think because it's so relaxed, it's not. It makes you feel like it's really relatable. It's really relatable. That's what's extra special about it. Yeah.
I think Cynthia had asked me earlier where I work now. So the hospital systems that I work for are through a company called Equum. So it's like several different hospitals.
So do you work at NYU Langone?
No. So I work through a company called Equum, where we do contract to different hospital systems, generally rural ones, some in person and some telecritical care. So it's actually a really cool gig. Some of the hospitals that I go to, like there's a couple in Texas, there's one in upstate New York. Now, most of the stuff that I do is tele, it's like remote critical care, but at times you do need to be on call in person as well. The hospital system that I was at for my fellowship, if that's what you're asking, is Mount Sinai.
No, because see, I'm on this thing because of my husband. He has kidney failure, so he's on a kidney donor list, waiting for the kidney.
Sure.
So yeah. So I don't,
not a transplant doctor. No. Yeah.
Hey, thank you so much for sharing. Our stories are very, very similar on how quick it might happen within less than a week from getting listed. So.
Wow. Yeah. It's really crazy. I mean, I've taken care of tons of transplant patients by now, especially during fellowship at Mount Sinai, and it's very rare that we more commonly see people who are chronically ill and with a transplant. And one of the things that I tend to always also talk about is the difference between acute and chronic organ failure. Acute, they each have their separate issues, and they're very different as far as, the the things that you go through even before getting the transplant or after, and kind of the processing that you have to do is very different for both with
agreed.
whichever organ.
Yeah. I mean, I'm a year and a half out from my heart, and like, just it's fun for me to meet others who have had a heart transplant and kind of know like what it's like, and to see you further out. So I guess
Yeah,
I do have
I
a couple
totally
questions. Like, from a supplement standpoint, do you take like the multivitamins and the magnesium and the calcium and all that stuff still?
Yeah, I do. So Prograf is one of the medications most of us probably take. Prograf is magnesium wasting. So it is really important to take some sort of supplement. Usually your doctor will tell you which one is best for you. Some people want magnesium oxide, glycinate, chloride, whatever it is. But generally speaking, you should at least be taking magnesium, especially if you're on a specific set of medications for the rest of your life. But not everybody is on it. And obviously it depends on which organ you had prior.
And then how's your sleep been impacted since yours? Because mine's kind of hit and miss some nights. Like, some nights it's fine, and some nights it's just.
Yep.
Yeah, I think early on, especially when you're on prednisone, even when you're off prednisone, the first couple years, your sleep is greatly impacted. Prednisone is one of them that messes with your sleep. I'm sure many of you guys know how difficult it can be to be on that medication. But eventually, I always say, you know, no matter what, whether it's transplant or an acute illness or cancer, whatever it is that you're dealing with as far as your health, it usually takes your body a couple years to get used to it, whether or not you're on medications forever or not. And sleep is one of those things that's usually impacted, unfortunately.
And do you take like melatonin or anything, or do you try not to take anything? So.
Yeah, so personally, I don't, but I know initially my first year, I had a prescription for, I don't remember, maybe it was like hydroxyzine or something, trazodone, maybe one or the other. Talk to your doctors to see what you can be put on. Melatonin, I'm a big fan of, just because it's like the easiest over the counter, very low dose, doesn't mess with most medications, but yeah, it is totally okay to ask your docs to get on something for sleeping, especially early on.
Cool. Thank you so much for sharing. So,
may I talk? Like, I had a liver transplant a year and a half ago, and I know a lot about having trouble sleeping. I'm on a Facebook transplant page, and you could also, a lot of people swear by gummies. I don't know if it's legal wherever you live. In my program, they said no, but a lot of programs say yes. So if it's legal, you could ask your doctor in whatever program you're in, because people swear by it.
Yeah, I think, are you talking about like THC or CBD gummies?
Not CBD, THC. Yeah.
Yeah. Just if anybody does ever want to try that, I always make sure their teams know, just because that can mess with your TAC level.
Right. So. Yeah. That's why I said that you have to ask your doctor. I asked my doctors and they said no.
Yeah.
So yeah. I have my bad nights and my good nights.
Yep. I find the days I like exercise and like active, that helps me sleep better, which that's general for all of us anyways. So like,
exactly.
Also, I ended up getting a transplant at Beth Israel in Boston, but I had to switch hospitals to Beth Israel. I had some issues with my first hospital, and I even went to Mount Sinai and met with a doctor. I had a liver transplant with Dr. Shiano, I think was his name. But I decided that it was too hard to be in New York, to have a doctor in New York. And I did find a wonderful program at Beth Israel, where the doctors were much more attentive than at that other hospital that people all talk about. That's so wonderful.
Yeah.
I won't mention the name.
That's okay.
Yeah, I think we all, have our ups and downs with sleep and medications and different experiences at different transplant centers, right? It's kind of a hit or miss, right? We can all relate differently with personalities, with different docs and different surgeons along the way. And you have to find, what's better suited for you and where you're going to feel most comfortable at a transplant center that works for you, because you're going to build a connection that hopefully lasts the life of this organ at the transplant center. So you really have to do what's best for you and to advocate for yourself at the center and for you as a patient. And that's what's most important. And you have to keep that in mind when choosing a transplant center. So
my first hospital didn't even tell me I needed a transplant. So I was like, when I went to Beth Israel and the doctor said that to me, I was like, looked at him like, what? So yeah, he was right. But yeah, like you said, things happen. Mm.
Yeah, it's hard. Like I said, you have to be your best advocate moving forward and act on what's best for yourself. So I'm glad you found a transplant center that worked best for you. Yeah, that's really important.
So am
Karen.
I.
Yeah, that's great. That's great.
I know if any of you guys have ever switched centers, like I had gone from Penn and then I switched to Mount Sinai when I was living in New York. Now I'm in LA, so I'm at Cedar. So I always joke that I'm doing like a tour of all the transplant centers.
You're networking and relationship building. It's okay.
Yeah, exactly.
I have a question, if I may. I had a heart transplant on April 17th, so 4 months ago. I have a question about the scar, because in the internet they give a different information. Somebody says those silicone strips are helping, or just pure medical silicone. Did you use anything for your scar?
I did not. Generally speaking, like scar treatments are really hard to come by unless you go to like a dermatologist and they give you like, I don't know, maybe some sort of prescription, something or another. In general, I'm one of those, I just show it off a lot. I actually had to get hip replacements because of the transplant medications that I was on. So I have scars everywhere and I try to just embrace them. There's really nothing else. Now, sometimes you do want to put like a cream or something on it because it's like itchy or something. And I don't think that there's anything specific that I've been told is better than others. In fact, my own team told me, there's nothing you could do about it. Now, keep it out of the sun, use sunblock. I think vitamin E oil sometimes this also works, but the thing is you have to be careful, especially if you're still early on out, because it's a nidus for infection. So be careful on what you put on there too. But yeah, ask your team. I specifically never used anything. And I have to deal with it now, but I think they're beautiful. So
yeah, it's not about the scar itself. It's about I have like a little bump on top of it.
Yeah.
What makes it feel like when they started to open, I guess, here. And it just, the skin around is very under pressure. So I thought maybe
yeah. I know what you're talking about. I have the bumps too. Usually like the women usually could feel it more than men. And sometimes it depends on like how thin your skin is. In a couple of years, if it still bothers you, you can have them take the wires out, which might save so you don't have to feel that anymore. But then usually within a couple of years, it looks, it doesn't have that bump. So it's something you can ask your team.
Okay, thank you so much.
Yeah, I felt that quite a bit the first 6 months, and then the further out I got, the better that felt. So yeah. But at first it does feel funny, and like I still feel like my chest is healing some days too. So.
Yeah, for sure.
Question. I recently got transplanted back in October of 2022, a kidney transplant. And like the first couple of months, everything was, good and fine. And then something called the BK virus showed up. And the numbers were, going up and down, up and down, up and down. They wanted to biopsy and see, what was going on. They actually took me off of my immunosuppressants, and it ended up causing my lupus to come back and scar my transplanted kidney. So it's been really, stressful. It hasn't even been a year. So I've just been like really fighting to, get my creatinine number back, my GFR. Like if you guys could recommend anything to kind of, help with that, positive, keep the faith with dealing with that.
Yeah, I think that's, transplant comes with ups and downs. Some people have more complications, some people don't, some people have rejection, some people have different side effects that they feel. It's what I always say, as like cliche as it sounds, it's all just kind of part of the process, and there's only so much that you can do in the moment. Keep doing what you're doing. BK it's a complicated thing to treat, especially in kidney transplants. And it's one of those things where most infections in general, like we go down on immunosuppression because of the infection, and then the infection gets worse, something else, there's all these little things. So it's just a matter of not giving up hope, and knowing that part of the process is going through these things sometimes, which sucks, but it that's how I see it, at least.
Yeah, I think it's really like the roller coaster ride, right? That's kind of why we call it the transplant journey.
Right.
It truly is the journey, right? You never know which path it's going to take you down. It's got the pluses and the minuses of it. And I really kind of think, as much as we talk about, these medications are a blessing and a curse, because they are, they keep us alive, and they also cause some of these side effects that we don't know what they're going to do to us in the long run. And it's each day is kind of a crapshoot, right? On what it's going to do to us. Is it going to, give us insomnia? Is it going to, make our hair fall out? Is it going to do this? Is it going to do that? Is it going to give us night sweats? Is it going to make us nauseous and give us, tummy issues one day? We really don't know. But I think part of it is also, trying to remain as positive as we can, and surround ourselves with, communities like this and support groups where we all know we're together and we can relate, because we've all gone through little bits and pieces like this, and we're here for one another because, we've all experienced one little puzzle piece like this, and it really helps.
Yeah. And I also, I always tell people that sometimes as a transplant recipient, I think Amy Silverstein had written about this a few months ago. As a transplant recipient, it's almost like you have to always feel grateful, right? And so we feel like we could never complain. And I make it a point to say, like, no, you can complain as much as you want. I mean, just know that the limits, like if there's something that's bothering you, it's okay to be annoyed about it. It's okay to be sad. It's okay to talk to other people. Now it's up to you to either dwell on it or just kind of think, okay, well, this is what I got to deal with, and move on. So I think that, it's okay to also feel that it sucks sometimes, it's just the way it is.
Yeah, absolutely. Absolutely. Yeah.
You always have to take into consideration that you're strong enough to fight off whatever's coming at you after you get your transplant. Most people anyway, not everybody, but most people do.
Yeah, exactly.
Yeah, we're warriors for a reason, right?
Yeah.
I mean, that's how we got here, and that's why we keep fighting the battle every day, right? We wouldn't have made it as far as we've come.
Yeah.
That's how I kind of look at it.
So I know Jen has heard this before, but Doc, you haven't. I have had 79 various surgeries in my lifetime. The transplant for me was a kidney pank, like Jen, 7 years ago, July 9th. And I am definitely a fighter. I'm all about it. And I spread the word with a lot of other people in the world that kidney and organ donation is definitely a big deal. And I've even taught my nurses at the hospital where I go, which is Georgetown in DC. And I've taught a lot of the girls there and guys there about transplant, because they have no idea. They get into their specific treatment plan and then they have no idea about it. Glad you're out there spreading the word.
I just want to know, how can I go maybe in DC to put my husband's name on a kidney list to get a kidney?
You have to talk to a transplant center there. So the Washington Hospital Center, Georgetown has one. It depends on if you're doing kidney specific. Georgetown or the Washington Hospital Center are two that will. I'm not sure who else in MedStar does.
Where it's located in DC?
Yes.
And do you have their number?
I can get it for you.
Okay, thank you.
And Cynthia, I think since you're specifically looking for, a living donor, it's more about, spreading the word and sharing your story and getting out there. And what you really want to do is you want to be looking for transplant centers, that have a really low wait list
Yeah,
as a backup for deceased donation, right? For your husband, Peter, in
Yeah.
this situation, right? So
yeah,
just because, maybe Harold is speaking about his excellent experience at Georgetown, you want to look and see how long the wait list is at Georgetown. There might be another transplant center that has a lower wait list
yeah,
than Georgetown, right? His
yeah.
experience is excellent at Georgetown, but there might be another center that has a lower wait list time than Georgetown, for example.
Yeah,
Yes.
you definitely have to do your research on that. But here's the number for their transplant center:
Yes.
202
Uh-huh.
444
Uh-huh.
3700.
Okay. I'll give them a call. Yes.
Sure.
And then the other thing I also want to add is you're going to want to make sure that your insurance is also going to allow you to multi-list at other transplant centers.
Yes.
And because Peter hasn't been on dialysis that long, he's, might not also be on Medicare as yet. So that's something else also that you want to take into consideration.
Okay.
I'd like to make a comment about that because I was actually getting listed at Georgetown because I have family in Maryland. And then I also, the week after I got I was supposed to go to Arizona to Mayo because they had a really short wait list. So if you're willing to possibly relocate for X number of months to a state that has a much shorter wait list like Arizona or Florida, that would increase your chances if you're capable of doing that.
Do you have the Arizona number?
No, I don't have it anymore. I was supposed to go there in May of 22. You can just Google it, Arizona, Mayo Clinic in Arizona, and you can find the information. They were very helpful. I mean, they have a place that you could potentially stay. They were very helpful, but I was able to cancel it because I deteriorated. I was sick for years, and then everything went very quickly after I was sick for years.
Oh, now you look much better.
Oh yeah, I'm much better.
That's good. All right, so it's Arizona Mayo Clinic. So I got to get their number.
There's also a Mayo in Florida. I just didn't. I had some issues with some of the things they said to me, so I was like, no. But call the one in Florida. People are very happy with it. I'm just saying they have much lower wait lists than they do like where I live.
So that one is Mayo Clinic. So that's the one in Mayo Clinic in Florida.
Yeah, they're all connected. So you can just look Mayo Clinic, and then there's different campuses throughout the United States. The ones that have the lowest wait times appear to be Florida and Arizona.
Okay.
So you don't even have to go that far. I mean, you can just look at Hackensack, which, as of about like 3 weeks ago, only had 300.
Well, he's already with JW. Remember I told you? He's already with them too.
Yeah.
So
Tampa General has a short list as well. Tampa General.
Tampa? Okay.
It's a horrible thing to say, but they say that they have like a high motorcycle accident rate.
Yeah.
So
wow.
lists are a lot shorter.
Tampa General. Okay, I'm gonna check on that too.
Tampa General.
Call them donor cycles in this group.
Yep.
The people that ride without a helmet.
Yeah.
Yeah.
Also check out Toledo General.
Who?
Toledo General.
Toledo?
Ohio.
That's Ohio or Ohio? Okay.
No. University of Toledo Medical Center.
General. Okay, I'm writing those things down. Sorry.
But the one thing you have to remember, and again, I'm not an expert, is it goes by region. So you don't want to be multi-listed at a hospital that's in the same region that's fighting for the same organs.
Okay.
So you have to see what region you're in.
Well, I live in Long Island, New York, but I guess I could go up to Florida.
I don't know. Yeah, but I don't know what, you have to look, so you make sure you don't multi-list, and so you're in competition with yourself.
Yeah. Yeah. They said the furthest I could go is Florida. That's the furthest I could go. So
Well, how about for our guest speaker? Does she have any questions for us?
I was actually gonna say I actually have to get going, but I'm gonna put all my information in the chat so you guys can email me if you have any questions. I'll put my website and the podcast there too. But thank you so much for letting me chat with all of you. I'll try to join again later on this year. Jen, thanks for having me.
No, thank
Thank you.
you so much.
Thank you
Ellen.
so
It was
much.
Absolutely wonderful.
We
We
really
so
appreciate
Thank you.
appreciate it, and for sharing your story with us and
Of
your
course,
courage
and always advocate for yourself. Don't ever feel bad or don't ever feel like you can't like talk back just because someone is a doctor or like, you have the authority to do your own research. You can advocate, you can do all of that. So don't ever feel bad about advocating for yourself. And I make sure everybody knows that. Okay.
Thank you so much.
you.
We really appreciate your time
Thank
tonight.
you.
I know you squeezed
Thank
us
you.
in. We're so appreciative of everything that you do for all of us.
Of course. Bye everyone.
Thanks so much.
Bye. Bye,
Thanks,
Alan.
Alan.
Bye.
All right, guys, I hope you enjoyed tonight's presentation. She's just like an amazing warrior, incredible story, just kind-hearted, just like I said, a warrior amongst us all. So hopefully you guys enjoyed that with all of us. I'm going to stop recording if I can figure this out. Hold on, let's see. Let me find the button here. Put my glasses on.
Oh, wait, I haven't. We haven't talked about the weather yet. Wait, not yet.
Wait, Charlie. Yeah. Wait, let's see. Let's see. Recording. Here we go.